In today's age, we are very fortunate to know that when we go to the doctor or to a hospital for a medical procedure, we are getting the safest and cleanest procedures available. In medieval times and the Middle Ages, the general public was not so lucky. In the past, sterilization and cleanliness was unheard of. If you were ill or needed surgery, the methods of survival were extreme and dangerous. We have listed several examples which demonstrate how far we have come to gaining a greater understanding of how specific procedures were performed. Needling, an early surgical attempt to remove cataracts that would rarely save patients' eyesight. Back then, surgeons would use a thick, flat needle and push it into the cornea of the eye, without any anesthesia. The purpose of this technique was to push the opaque lens back into the lowest part of the eye, which would result in a clear pupil. Cataract surgery developed over time with the use of syringes that could be used to extract the cataract through suction. Today, cataract surgery is performed by removing the cloudy lens and replacing it with an artificial lens to restore clear vision. The procedure typically is performed on an outpatient basis and does not require an overnight stay in a hospital or other care facility. Bloodletting is an old practice of surgically draining blood from the body in order to cure a variety of illnesses and conditions. This practice came from an idea started by Hippocrates, who stated that the human body contained 4 humors: blood, flagellum, black bile, and yellow bile. Humorism, a highly individualistic form of alternative medicine. It is said that a deficiency or an excess of any or all of the 4 bodily fluids directly influenced one's health and temperament. During the Middle Ages, if you visited a doctor for a mild headache or cold, you were more than likely be prescribed a common bloodletting treatment. Another common method of bloodletting involved the use of leeches. Leeches would be placed directly on the concerned area and were thought to suck the illness right out of the body. In modern-day medicine, bloodletting is not nearly used like it was in the past, nor in the same manner. If you have ever given blood or have had blood work done, you have had a much more safe and controlled form of bloodletting, known as phlebotomy. Draining blood in modern medicine can still be beneficial in the case of some diseases, and phlebotomy is much safer, more accurate, and overall better practice than the bloodletting used in the past. Trepanning, a surgical procedure involving drilling of holes into the skull, is known as one of the oldest forms of neurosurgery. In pre-industrial time, they would scrape away the bone with stones until the introduction of drills and sawing instruments. The patient would be fully conscious and with no use of anesthetics. This procedure was used to treat patients' illnesses such as epilepsy, migraines, depression, and other mental disorders. It was also performed as a theory to get rid of spirits from the mind. It often ended in fatality due to exposing the brain to germs. Today, modern-day neurosurgery is less invasive. Mental illnesses are treated with prescription medications. Trepanning today is still performed. However, many doctors try to dissuade people from the procedure. People believe that trepanning gives individuals a higher state of consciousness, relieve headaches, and just an overall state of well-being. Others claim that there is no evidence that there are any beneficial effects to this procedure, despite what people claim. Some perform trepanning on themselves for the supposed experiences it provides after being turned away from doctors. Anesthetics. In medieval times, there was no such thing as anesthesia. If you were getting surgery, your doctor would give you strong doses of wine to dull the sensations of pain. Later, Horace Wells discovered he could use nitrous oxide to perform a tooth extraction on himself, without experiencing pain. Later, ether, cocaine, and chloroform were used as anesthetics. Cocaine was introduced as an anesthetic for eye surgery. Today, there are many forms of anesthesia. Which type is used depends on the procedure that is performed. Local anesthesia numbs a small part of the body for minor procedures. Regional anesthesia numbs larger parts of the body, like the legs. During childbirth, another regional anesthesia known as epidural is injected into the spinal cord to relieve pain during delivery. General anesthesia, which affects your brain and body, is received through a vein or by mask. The patient is unconscious and no pain is sensed during surgery. Unlike the past, your blood pressure, breathing, heart rate, and other vital body functions throughout surgery are closely monitored to ensure patient safety. Antiseptics. Antiseptics were first discovered by Ignaz Semmelweis, a Hungarian obstetrician. When surgeries or major procedures were performed, flesh and blood were not washed off of hands, often leading to infection. During childbirth, an average of 20% of women died from infection. Semmelweis found that rinsing the hands with bleach lowered the fatality rate to 1% of women giving birth. After this historic discovery, people found that cleaning areas kept them from infection. Wounds began to be wrapped with bandages soaked in carbolic acid. Sepsis and post-op infections declined immensely after this. In the pre-industrial era, surgery was a last resort for patients because it often led to death. However, with the progression of antiseptics, surgery became a viable method of treatment. Today, infection is hardly a worry in the recovery process due to the highly advanced antiseptic procedures used. We have come extremely far from our past when it comes to how medical procedures are performed. Today, patients can rest easy knowing that they are receiving the best possible care from their doctors and nurses, who have received extensive education and possess immense knowledge of their practice.